So thank you for joining us, Dr. MacMillan, taking part in this interview for the MS Society.
Yeah, thank you for having me.
Can you explain a little bit about your background in research and your educational background as well?
Sure. So I'm trained as a physicist. I studied biophysics and medical physics at UBC, and I did a PhD at the University of Bern in collaboration with the Swiss Federal Institute of Technology in Zurich, and then I just started a fellowship at UBC in February.
Now, what kind of research are you doing at UBC?
So I use magnetic resonance imaging machines, but instead of taking a picture, I do a technique that allows you to define a box inside the brain where we can take a chemical fingerprint of that box and get some really specific information about the chemicals in the brain.
And how does that relate to MS? What kind of chemicals are you looking for?
Right, so magnetic resonance spectroscopy, or MRS, can assess the relative levels of several different types of chemicals, so we can see markers of neuronal health, glial cell health, the energy balance, neurotransmitters like glutamate and GABA. And so we can see a few of these very important molecules, and we can see how the disease causes changes in these levels, often even before you can see a lesion on the MRI image.
So it helps to detect MS early.
Definitely.
And does it also provide information on the stage of disease that the person is in, if they're progressive or relapsing, or is that where sort of the future is for this?
I think that's definitely the future for spectroscopy. Some recent research has shown that there are differences between relapsing remitting and primary progressive or secondary progressive MS, particularly looking at something called glutathione, which is an antioxidant. It's actually a really interesting poster here by another group. Yeah, so I think that possibly staging, but even before staging, looking at what are the underlying mechanisms that are causing damage to the brain before we even see the lesion on an image.
Very advanced. And how do you like working with Dr. Trabulsi in his lab?
Well, it's a very interesting lab. We have people from so many different backgrounds working together, and that's one of the things I like best about working in MRI and multiple sclerosis is that we have people working with backgrounds like physics, like us, or clinicians like Dr. Trabulsi and some of his fellows, and immunologists, geneticists. At UBC we have quite a network, and we meet quite regularly to discuss our findings and help each other interpret what we've been working on. And it's a really multidisciplinary group, and I really enjoy that aspect of working in this area.
That's great. And what else do you look forward to hearing more about at the conference in MS here this week?
Right, so I'm really interested in looking at how we define progressive MS. I think that this is an area that is still quite new. What makes the disease progress, and what makes that different from the relapsing remitting form? It appears that there are not very many measures we have to track progression, and so this is actually one area I'm trying to work in, is trying to come up with some objective measure that helps us track progression over a short period of time. One of the things about this disease is it's a very long disease course, like 15 or 20 years. But if we want to test a new therapy, we don't want to wait 15 or 20 years to find out if it's working. It would be really nice if we had some marker or some measure that we can perform that will track treatment as quickly as 1 or 2 years after beginning of treatment. So that's something I'm quite interested in, is looking for what changes can we detect early enough to say whether treatment is working or not.